Good morning, everyone, and thank you so much for joining us today. My name is Tim Rutledge, and I am the President and CEO of Unity Health Toronto, and it is truly my pleasure to welcome you all to St. Joseph's for this incredibly exciting announcement, one that moves us forward in our effort to secure the future of healthcare in West Toronto. I'd like to begin this morning with a land acknowledgement and then some very special welcomes. As we gather today to connect on the work of Unity Health Toronto, I want to acknowledge this land, the people, and all other beings, animate and inanimate, today, as well as the ancestors. This area has been a place of communities coming together for well over 15,000 years. This land has been the territory of the Huron-Wendat, the Petun Nations, the Seneca, and most recently, the Mississaugas of the Credit First Nation. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and allied nations to peacefully share and care for the resources around the Great Lakes. Today, the meeting place of Toronto is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work in this community. We are also mindful of the broken covenants and the need to strive to make right with all our relations, sharing stories and telling the truth of this place. Miigwech. Today is a very special day for St. Joseph's, and we're honored to share with it with some of our valued Ontario government partners. I want to extend a very warm welcome to Deputy Premier and Minister of Health, Christine Elliot. I also want to extend my heartfelt best wishes to you, Minister Elliot, on your upcoming retirement. It is so well deserved, although we will certainly miss your tireless leadership and your deep commitment to healthcare in Ontario. Many thanks. Also very pleased to welcome Minister of Infrastructure and MPP for Etobicoke Centre, Kinga Surma. Minister Surma has been instrumental in getting us to this point. We would not be here without you, Minister Surma. Thank you. And MPP for Etobicoke-Lakeshore, Christine Hogarth, who from day one has been unwavering in her support for St. Joe's. Thank you. We're also incredibly fortunate to have such wonderful MPs who understand the mission of our hospital and believe in what we're doing. You are always here with us and for us, and we could not be more appreciative. I'm also very proud to be joined by members of our Unity Health Executive Team and our Board of Directors, and members of the St. Joseph's Foundation and Foundation Board, as well as some of our staff and physicians and other leaders at Unity Health. Welcome and thank you all for being here. This group works day in and day out to provide the best possible care experiences for those that we serve, our patients and our families. And they've done so while facing some incredible challenges over the past couple of years. So I'm very honored to call them my colleagues. And so with that, I am very pleased to welcome Minister Elliot for today's announcement.
Well, thank you very much, Dr. Rutledge, for your very kind introduction, and good morning, everyone. It's always a pleasure to come to St. Joseph's, but especially today alongside my good friends and colleagues, Minister Surma and MPP Hogarth. Both have been incredible advocates for families in Etobicoke and West Toronto, championing key health infrastructure projects to end hallway health care for our communities. But thank you to the teams at Unity Health Toronto and St. Joseph's Health Centre for welcoming us. And thank you for everything that you do each and every day to provide exceptional care to patients, especially during the COVID-19 pandemic. For over a century, St. Joseph's Health Centre has gone above and beyond to keep families in Toronto healthy and safe. Your commitment to providing compassionate, patient-centered care is truly remarkable. Thank you. Now, long before any of us had heard of COVID-19, seems like a very distant day to me, but long before we'd heard of it, our government made a commitment to end hallway healthcare. The last 2 years have only reinforced the need for a stronger, more resilient healthcare system that truly meets the needs of Ontarians. This means adding more beds to hospitals and building state-of-the-art infrastructure to support the incredible efforts of all of our healthcare workers. That's why I am very pleased to share that our government is investing over $1 billion to redevelop and expand Unity Health Toronto's St. Joseph Health Centre. This funding will deliver a new state-of-the-art patient care tower and support renovations to the existing hospital that will expand much-needed healthcare services. We're adding over 100 new beds and building new spaces for operating rooms, critical care, and the medical, surgical, and mental health programs. This over $1 billion redevelopment will also include an expanded emergency department that will help ensure that patients have access to high-quality care when they need it. In addition, we have provided Unity Health Toronto with Stage 2 construction approval for this redevelopment. The hospital is expected to begin construction in the next few years once planning is completed. St. Joseph's Health Centre has been caring for families in Toronto for over 100 years, and it's critical that the hospital grows alongside the communities it serves. By investing in the expansion and redevelopment of St. Joseph's Health Centre, we are ensuring that this world-class hospital can continue to deliver high-quality care for generations to come. So once again, thank you to Unity Health Toronto and St. Joseph's Health Centre for everything you do to ensure that Ontarians get the care that they need. So thank you once again, and I would now like to turn it over to my colleague, Minister Surma, to please say a few words.
Thank you very much, Christine and Tim, and Christine as well. I am very happy to be here. When I was elected as the MPP for Etobicoke Centre back in 2018, and I came to visit St. Joseph's Hospital, I just truly fell in love with the staff and the team here. Now, I think everyone watching at home can just imagine how difficult it has been for healthcare professionals working throughout COVID in a hospital setting. But one has to think about how extra difficult it must have been for the team here to work in a facility that is close to 100 years old. And so I'm very, very excited with this $1 billion investment. I know that the team here has been working so incredibly hard and deserve to have a state-of-the-art facility so that they can provide the absolute best care for patients in West End, Toronto, and of course in Etobicoke. So thank you so much, Christine, for supporting this initiative, and I'm just very excited for the hardworking team here. Thank you.
Thank you. It's actually an honor to join this amazing team that I get to work with every day, and Dr. Rutledge, to bring healthcare to the home where I live. I was a patient here just even last Wednesday, and you have to remember, what is the heart of this place? It's the person who came and greeted me at the door to hand me a mask. It was the next person when I went to through my staging and my check-in to tell me where I needed to go. And then when you forget where you're supposed to go, it's the people who say you're going the wrong direction. Those are truly the heart of this organization, and I thank all of you here, all the staff, for the work they do every day to make the people of Etobicoke feel comfortable, especially in a time of need. Now, we've already talked about the details of today's redevelopment and expansion, as it's such an exciting announcement from Minister Surma and Minister Elliot. But I'd like to spend a few moments reflecting on the history and the origins of this beautiful facility and the women who originally brought it to life. This place was founded by the Sisters of St. Joseph. They were a congregation of Catholic women founded in France in 1650, Four of the sisters arrived in Toronto in 1851, initially to teach and to run an orphanage. In the ensuing years, the sisters created St. Michael's Hospital, Providence Healthcare Centre, St. Michael's Homes, Nazareth House, the Furniture Bank, and Fort Bond Ministries. Not to mention, of course, what would become St. Joseph Healthcare Centre. The sisters are called to serve those in need with simplicity and compassion, the homeless, the alienated, the poor, and women at risk. And of course, their spiritual inspiration has been known throughout time as the patron saint of workers. It is these women and this place that we celebrate today through this amazing announcement. And their spirit lives on through the dedicated healthcare team that work at St. Joseph today. Those who have struggled with difficult times over the past 2 years at great peril to themselves. But judging from their founding principles, their own well-being has always come second to those needs that they are truly originally called upon to help. And they still do today. The poor, the at-risk, and those who need the extra help. I just want to thank everybody, thank the workers for all you do, and congratulations on this amazing announcement.
Thank you, MPP Hogarth. Thank you, Minister Surma and Minister Elliot. Once again, I want to reiterate to you how grateful we are for your support of St. Joseph's. It takes collaborative effort to build a hospital, and we're so fortunate to have all of you on our team. Today's announcement comes after a lot of dreaming, planning, and reimagining the future of St. Joseph's to better support our people and the 500,000 people that we serve in West Toronto. Thanks to Minister Elliot, Minister Surma, MPP Hogarth, Premier Ford, and everyone at the Ministry of Health, our dreams can now become a reality. This new tower, which will be built right here where we're standing, will help us to improve the patient experience and increase the capacity of our healthcare system, particularly in West Toronto. For more than a century, we've been caring for our passionate neighbors in West Toronto, and we plan to do so for many, many years to come. In the next 10 years, the population in West Toronto is expected to increase by more than 125,000. That's 15% increase. This investment of more than $1 billion by the Ontario government will help us to grow so that we can continue to support the health care needs of our residents and future generations. We'll be able to care for patients in modern spaces, improve access for the most vulnerable, and reduce wait times. We'll be able to provide more private patient rooms, the latest technology, and operate more sustainably. Our communities deserve this, and our people do as well. The last 2 years have been incredibly challenging for all of us, especially those of us in healthcare. Not only have they been dealing with the demands of COVID-19, but they've been working with infrastructure that is 60 to 90 years old. One of the oldest buildings on our campus, the East Wing, was built in 1931, and it still operates as an inpatient facility. As you can see, this work is long overdue, and thanks to our Ontario government partners, we can finally make this happen. On behalf of Unity Health, I want to express my deepest gratitude once more to Minister Elliot, Minister Surma, MPP Hogarth, Christine, and Premier Ford, and everyone at the Ministry of Health. Thank you for seeing the need and investing in St. Joseph's, and thank you for giving all of our people, patients, and communities something to get excited about after such a difficult couple of years. I can't tell you how much we appreciate this announcement and how excited we are to continue to work with you on this incredibly important project. So folks, thank you all for coming. Have a great day, and we'll now pass it back to Minister Elliot in case there are any questions.
We'll now take questions from media. If you have a question, please line up beside me here at the mic, and it's one question, one follow-up. Thanks.
Good morning, Minister. I wanted to ask you about an announcement this morning by Liberal leader Stephen Del Duca. He has said that a Liberal government would ban handguns province-wide, and he accused your government of kowtowing to the gun lobby, and I was wondering what your response might be.
I would say there's no kowtowing to any gun lobby, but that is something that I'm sure our Attorney General and Solicitor General will have something more to say about later today.
Okay, thank you. Also, on another issue, the April 27th deadline for the lifting of masks.
Yes.
Have you rethought that? Have you come to a conclusion about what you're going to do there?
Well, I know that that is something that Dr. Moore has been studying about whether the April 27th deadline should be extended for the wearing of masks in places like public transit, hospitals, long-term care homes, congregate living, and so on. He's indicated that he is thinking that that might be necessary. However, we haven't seen a formal recommendation as yet from Dr. Moore, but as we always have, we will be waiting for his formal recommendation and certainly will act accordingly. Thank you.
Thank you.
Hi, Minister. I have questions from my colleague, Jack Howen. Emails acquired through Freedom of Information requests show your Chief of Staff worked to tone down language in a statement put out by the Premier's office about Dr. Fisman's relationship with the ETFO back in January of last year. Those emails also show that Dr. Steiny Brown had serious concerns with the statement. In your opinion, was the Premier's office trying to hurt the reputation of its most prominent COVID critic?
Absolutely not. We have always listened to Dr. Moore and his colleagues. There have been others that have had different views, but that's been for them to state freely. We have not had anything to do with that. If there's something that they want to say, they are absolutely free to say whatever they want to say.
One draft of the statement said the government had sought a resolution to ensure clear conflict of interest screens are in place with regard to the science table. What does that mean?
Well, if there's a situation where someone is on the science table that is involved with another organization that may be contrary to what the policy is that the government's putting forward, it would be something that I think that the rest of the table would need to know about. I think that's being transparent with your colleagues and transparent with the other people that you're trying to serve. But that's not something, till now, everyone on the science advisory table has been free to state whatever it is that they want to say. And that there has been no government involvement in that. And I know that for Dr. Steiny Brown, he's indicated that it's because they are also academics, that it's really important that they have the ability to freely state their views. And I wouldn't disagree with that.
Thank you.
Hi, Minister Elliot. Mike Crawley from CBC.
Hi, Mike.
I wanted to ask you about today's announcement because I couldn't help but notice that last week there was $1 billion for Scarborough Health Network. You've also made hospital construction funding announcements, or planning funding announcements in Barrie, in Brampton, in Brantford, in Ottawa, all within the last few weeks. So how would you respond to people who might perceive that what you're actually doing here is basically pre-election campaigning?
Well, I would say that this is something that we've indicated for months, for many months, if not perhaps years, that we know that there are many hospitals across the province of Ontario that need renovations and in some cases need new hospitals because the infrastructure is so outdated, and many need renovations as well. We've already promised that we would invest up to $30 billion in the next 10 years in order to update hospitals so that the staff can continue to provide high quality care to everyone in their community. We know that in some hospitals there have been situations where there are pipes that burst, there's water breaking through the walls, there have been situations where the oxygen hasn't been available, the system is broken down so that they haven't been able to operate on people in a timely manner. This has to stop. We need to make sure that our world-class health professionals have great places to work so that they can provide the care that their patients expect and deserve. So there's nothing new in this. This is something that we have promised the people of Ontario for a very long time. We're making these announcements because it's time they need to get on with their planning, and that's what's happening here, for example, at St. Joseph's.
Right, and if there's nothing new about this, then that's actually double reason to ask the question about the timing. If you identified hallway healthcare as a problem, before the pandemic.
Yes.
Where were these announcements, in recent years? And what do you talk about pipes bursting? A lot of this construction isn't going to happen for years before it actually gets started. So, again, how do you defend the timing of this?
Well, because this has been going on for some time, it was 2 years ago when I was here to announce a $5 million planning grant for St. Joseph's Health Centre to begin planning for the work that is going to be ongoing. And you have to remember that this hospital is located on a very small footprint. So the planning has to be done very carefully and done in stages, because you just don't have an open plot of land to go and create a new structure. This is where the new tower is going to be going, so it's going to have to be demolished and then rebuilt. So there's a lot of timing that has to happen for this to take place. So again, it's not a new situation. The announcement was made 2 years ago, but now the hospital is able to proceed with the stage 2 planning to get the finite drawings done in order to be able to actually start construction. So none of this is just an announcement out of the air. The announcements that we're making now are, for the most part, moving from the initial planning grant through to the stage 2 for the next stage for the final drawings to be done. In some cases, some hospitals are ready to put the shovels in the ground. There's many at many different stages, but it's important for Ontarians and for the people in this part of Toronto and Toronto and Etobicoke to be able to know when this new tower is going to be done and when the renovations are going to be done to the building. As Dr. Rutledge said, some of the buildings date back to 1931. This is a long time coming, and people here deserve the renovations.
Hi, Minister. Christina, right over here.
Hi.
Hi, Minister. Long time no see. Christina Elliot from CP24. Dr. Venegal is a emergency room physician. He's outside. He's looking to speak with you. His concern is Bill 124. You're well aware of the concerns nurses have surrounding that bill. He says he doesn't work with doctors, he works with nurses. Bill 124 is a slap in the face to nurses. Recognizing, of course, that this impacts other public sector workers, I want to ask you about the upcoming budget. Can he and his peers, the nurses, anticipate more support for nurses in the upcoming budget? The concern, as well, as you're well aware, not only the burnout, but what many feel is a moral injury and a mental health issue.
Well, I can't say anything about the budget, of course. That will be revealed in the next short while. But I can say that we care very much about the work that nurses have been doing, and not just the last 2 years, but for many, many years. It's been especially difficult the last 2 years because many of them have seen things that even in the course of being a nurse is very difficult to see, and I would say maybe particularly in long-term care. Bill 124 exists for many public sector workers, but given the fact that we do recognize the incredible work being done by nurses, we have extended a $5,000 retention bonus to them. It's $763 million. It's not a small figure, but we want to keep our nurses. We want to acknowledge and recognize the incredible work that they've done. And the negotiations will be upcoming in due course. So there will be, we will see what more we will able to do for them. But there is that $5,000 bonus that is available to them in recognition of everything that they've done.
Why does it not extend to all nurses? It doesn't extend to nurses in schools, those in private care. Why doesn't it extend to anyone who is a nurse, an RN or RPN?
It extends to almost everyone, not quite. If you're a private duty nurse, then you will be paid separately. But for all nurses that are being paid through the public system that have been directly providing care to patients, that is registered nurses, registered practical nurses. We know that they've been through a lot. We want to recognize what they've done, and we want them to stay in nursing, and so we are having several good discussions with the Ontario Nurses Association, with the Registered Nurses Association of Ontario. I know there are other issues in terms of nursing for healthcare nurses, home care nurses, for example. There's also the issue of scheduling, the distances they have to travel, the increase in the cost of gas, for example, that they incur as they're moving from place to place. We're trying to help nurses with that as well. So there's the increase in the cost of the amount they receive for the work they do, but there are many other issues as well that we're trying to understand and resolve.
Last question.
Hi, Jamie.
Hello, Deputy Premier. How are you today?
Very well, thanks.
Premier, the numbers, the COVID numbers coming out shows a slight increase in hospital visits and ICU. Does that worry you? And what are you hearing about this last weekend where a lot of people were together, and that will even bump that up that number up a little bit more? I'm presuming this happened in previous long weekends. So, first of all, your interpretation of the numbers, and does that affect the masks and how we're going to wear masks, or how your government's going to mandate masks?
Well, as far as masks are concerned, except for the masking in public transit, hospitals, and so on, that's a separate consideration. But Dr. Moore does not believe at this point that we need to return to everyone wearing masks wherever they are. We have seen a slight increase in the number of people being hospitalized and the number of people in intensive care units. However, based on the modeling that's been done by the Science Advisory Table, we don't anticipate that this is going to hit the same heights that were reached in the fifth peak. But we also have a more highly vaccinated population. People are still going for the vaccinations. We have the fourth doses now available for people. We have the antivirals that are now widely available. And of course, we have capacity in our hospitals because of the extra 3,100 beds that we brought on at the beginning of the pandemic that remain open for both COVID patients or for patients who have gone in for other surgeries that have been postponed because of COVID. We still are carrying on those surgeries as well.
And this last question is just pure emotional, but this hospital has been known to hard access, whether it's through parking or public transit. And the new plan's going to increase access via public transit and parking. Parking's always a nightmare right here. I think Toronto's trying to pay off their debt with parking tickets around this place.
So I'm sorry, could you just, I didn't hear
Parking.
the
Is parking and access to public transportation going to be increased for this hospital? It's always been known that parking around this hospital, access to this hospital is always very difficult.
Yes. Well, we're doing a lot of work with respect to that, and with respect, I think there's somebody who is beside me who might be able to answer that question better. I'll ask perhaps Minister Surma to come and address that question, please.
Absolutely. Thank you, Christine. Those considerations are always taken into account when doing planning and throughout the planning stages. I'm sure Tim is working very closely with the City of Toronto to make sure that public transit is absolutely accessible and also, very convenient for those that are driving here to take care of their loved ones.